Ryan will have to give us the word when we're ready.
Good evening. We have a called meeting tonight of the Public Health Authority of the Cabarrus County Health Alliance Board. We have a very limited special agenda tonight, and we are streaming live on YouTube for the public. So just to remind everybody, we're on a public meeting, and hope everyone's doing well tonight. We're going to call the meeting to order now, and I need a motion to adopt the agenda, and we'll do the roll call at the same time.
So moved.
So Mark Spitzer has moved. Can I get a second?
Second.
Kim Daylor's a second. I'm going to go down the line. So present here, Mark Spitzer,
Yes.
Kim Daylor,
Here.
Daryl Adams.
Yes.
Kim, could you say yes if you agree with adopting the agenda?
Yes.
Okay, thank you. And then Cecilia Pless
Yes.
and Steve Morris
Yes.
and Asha Rodriguez.
Yes.
Okay. And is Dan Hagler on? And did I miss anybody? Okay, thank you.
Chip.
Oh, I'm sorry, Chip Buckwell? Hey,
I'm here.
gives us a thumbs up. I'm accepting that as a yes, and he's here.
Yes,
Welcome. Thank you for being here.
thank you.
Okay, so now we're opening the floor for informal public comments. Did we receive any comments?
Ryan, we did not get
I'm sorry.
any comments or
I did
questions?
not see any comments.
Okay. That's fine, comments. Okay,
Okay.
having received none, we're now going to move over to the business agenda, and I'm going to turn this over to Dr. Bonnie Cole, Dr. Steve Cathcart for proposing.
Yeah, I want to start out by thanking all of you for fitting this into your schedule. I know I got Asha's out of office, meaning she's on vacation. So thank you, Asha, for taking time out of your vacation to call in, and all of you, thank you. We did feel that we were dealing with a very urgent issue and did not want to wait until the August 16th meeting. We, like many other public health departments and health systems across the country, are really struggling to hire nurses, in our case, for our school nurse program. And so we have been strategizing about how to handle this situation, and we have a proposal that we want to present to you all tonight and have a vote, hopefully, of acceptance in order to improve our recruitment and retention efforts. And I am going to, at this point, turn things over to Steve, who will do the main presenting, and I will step in at any time to offer some additional comments. Thanks, Steve.
All right. Thank you, Bonnie. So as Bonnie mentioned, we're suffering from the same thing. A lot of people that provide these types of services are suffering, especially when it comes to nurses, and in particular for us as school nurses. So currently we have 10 of 49 positions vacant. So 2 in Kannapolis City schools and 8 in Cabarrus County schools. So since we posted for this position, at the end of the school year, we actually had 5 positions open, and we've continued to lose positions as the summer has continued. We've had 25 applicants, which is really not a high number. 10 of those applicants were dispositioned for various reasons. Some didn't meet criteria, some had incomplete applications, and 2 maybe withdrew their applications. So of those 12 interviews were conducted, 3 are scheduled for were invited to interview, and we hope they do interview with us. So that's a total of 15 interviews. Next slide. Yep. So out of the candidates, 12. I'm sorry. Yeah, 12. I couldn't get the number out. Out of the 12 that we, at the 12 that we've interviewed, we offered 11 positions and only 3 accepted. And so 8 total candidates declined. 6 declined due to salary and 2 declined due to the COVID vaccine mandate. All right, so this is what our starting pay is. And remember, if we go back to the salary study, last year, we raised our salaries from about $27 an hour starting to between $30 and $31 an hour starting. So we have raised our salary. Um, part of what we think maybe the challenge is that the salaries for RNs, ADN nurses, associate's degree nurses has gone up, right? And we have a higher requirement here at CHA. You have to be a BSN. We have to obtain a national certification and all of those things and we're starting at the same place that a new graduate actually could start with an RN. So that's part of the challenge that we face. Next slide. All right, now here's some of the incentives for other counties. I'm sure you guys have heard some of these incentives. One of the big ones that jumps out at me is the Orange County Public Schools is offering a $10,000 sign-on bonus for school nurses. And then our neighbor Mecklenburg County is offering a $7,500 sign-on bonus for school nurses and $2,200 bonus for all nurses. So people are different organizations or similar organizations are trying to incentivize nurses and particularly school nurses to come aboard. So we're not the only ones suffering from this problem. Other counties are as well. Next slide. So our proposal, we kind of put it into two phases. We want to try phase 1 out until August 12th. And we'll talk more about that in a second. But we want to do a tiered bonus approach for all of $5,000 for all new and existing school nurses. So $2,500 after the first 90 days of school. And then $2,500 at the end of the school year. Then you can see the total. If all 49 school nurses were filled, the total will be $245,000. And there is funding specifically for school health workforce, and it covers the majority of this incentives from North Carolina Department of Health and Human Services. By August 12th, if the $5,000 bonus does not net us a greater pool of candidates, if we have so we have 10 vacancies. If 5 or more are still vacant on August 12th, we would like the board to also approve that the health director be able to offer an additional $1,500 for new hires once they complete their 90 days for a total incentive of $6,500. So we have 10 open positions. Currently, we want to offer a $5,000 bonus, $2,500 in the first 90 days and $2,500 at the end of school. If that is unsuccessful and we still have 5 or more vacant positions on August 12th, we want that to be able to trigger the health director to be able to offer an additional $1,500 for new hires, which would be a total of $6,500 for their incentive. And there you can see the total cost between $75,000 and $15,000, depending on the number of vacancies. And lap salary will fund this strategy if necessary. Bonnie, did you want to add anything right here?
Yeah, I do want to say that as HR has been asking about the reason for declining, and they are saying because of salary. As Steve said, we are offering between $30 and $31 in general. And what they have been hearing back, Steve, correct me if I'm wrong, I think you said that they are pretty much saying they were expecting at least 37 an hour for start. And so, this is something we are probably, I believe that health systems across the country are having to offer higher and higher salaries. Asha, if you're comfortable sharing anything there would like your perspective, but this is probably something we're going to have to. Go ahead, Asha.
This seems very reasonable to me. I think what you are bumping up against is the competition occurring nationally for not just new grads, but the impact that the travel market has created for current and existing roles. So yes. Clinics, ambulatory care outpatients, all sorts of nurses we're seeing a challenge with that across the board. I think this is actually quite reasonable, and I'm a little surprised that you hadn't presented this as a challenge a bit earlier.
Yeah.
I got
So-
two comments on this. Number one is, since Mecklenburg's offering more, is that an issue? And the second, on the phase two, I would just say, since that triggers pretty quickly, I think you probably, if you have to do that trigger, you pay everybody you hire the higher incentive, not just the next 5 if you get them to sign, because that's going to create hard feelings.
Parity.
If someone
Yeah.
gets 5 and
And-
then a month later, the next one gets 6,500.
That would be our
Yeah.
intention, Dan.
Okay,
that
good.
It would be retroactive to the others that we've already offered.
Okay,
to
good.
avoid
I-
those
I'm
morale issues.
good. So we're kind of working our way up to Mecklenburg if we don't get any bites.
Yeah.
I'm okay with that.
And I would also add, Bonnie, that 37 is kind of the minimum number that people have got. At least 4 candidates I'm aware of have asked for $40 an hour starting, at least.
Sounds like they know the market.
Yes,
Is that,
absolutely.
what is the Mecklenburg hourly?
We don't have that information. One of the candidates actually was coming from Mecklenburg, and she said she left there making 35 and
Okay.
turned us down.
Mecklenburg,
So
we are, when we were doing our salary study and checking with some of the other health departments, we are offering about, in general, as much as, if not slightly more than the other health departments, except for MEC. They do offer a little more in MEC. I think it is in general because they also struggle to recruit the number that they need for various reasons. So I think we have a competitive salary for public health school nurses. Where the challenge comes from, as Asha alluded to, is there are other opportunities for nurses with both travel opportunities and within health systems to make substantially more. But that also comes with other inconveniences like weekend and holiday and evening work that in general is one of the advantages of a school health position. So.
And I think just in general, just the nursing, the demand for nurses has exploded. Insurance companies are hiring nurses all over the place as case managers, and those are often work from home positions, for instance. So it's all kinds of things happening all at one time, and it's unprecedented.
We know we know really nurses. Any more discussion? Any other questions or comments?
I just have one more comment, Bonnie. Kudos to you guys for pulling us together really quickly to walk through this. I think this is still going to be challenging, but I do applaud you all for bringing this to the table really quickly so we could make some decisions in support of being able to recruit and retain the teams that you have. They're going to be desperately needed in the fall.
Yeah.
Absolutely.
Yes.
Okay, any
Is
other
there,
questions?
yeah, I was just, those are pretty big deficits. I hate to say, how are you rationing the nurses you have?
Do you mean the deficit, meaning the 245,000?
No, I'm talking about just people covering the schools.
Oh, well, I'll allow it. Is Tammy can speak up. We've already been reaching out to the administration and the superintendents at the school districts and talking with them. They're aware that we will have some openings, and they have been very supportive and understanding. They shared back that they are really struggling to hire a number of other personnel in the school districts too, such as social workers and counselors and that. And so Tammy, do you want to jump in there too with the plan and thoughts for how to make sure that no school goes completely uncovered when we start back up in the fall?
Absolutely. Thank you all for coming together so quickly and for being receptive to this proposal. The school health admin team has been working to come up with what we consider the best plan to provide coverage. We know that it's not ideal, but currently what we're looking at is a zone coverage where we'll split the coverage between our team, so that's the school nurse supervisors, assistant directors, and myself, as well as other nurses. So with that plan, every school would have at least 4 days of coverage, which again, it's not ideal because we'd like to have a nurse in every single school, but we feel like it's the best that we can do right now.
I see that there are also several of the other supervisors are also on the call. So if I could take a moment and just really applaud the efforts of Tammy and the rest of the supervisor team, because they have been not just trying to supervise, but covering schools pretty much through the pandemic as we have been challenged to recruit nurses, and they have just gone above and beyond the call, covering schools, trying to be supportive to all the nurses, and being in that supervisory role too. So they have really been working nonstop around the clock, and really appreciate all of their
Thank you.
efforts.
Absolutely, thanks. How many supervisors are there over the school nurses, Tammy?
We have a total of 6 on our team. There are 3 supervisors, the 2 assistant directors, and myself, and we all have provided coverage during the past, I guess realistically, the past 2 years, because we've not been fully staffed at any time over the past 2 years.
At the risk of Bonnie kicking me, because she's sitting just across from me. And if you all who are supervisors close your ears for just a second, I would suggest that we also provide the same retention bonus to the supervisors.
And we might want to hold that until the official August meeting, because we will be bringing the proposal for the bonus for all CHA staff based on the county voting that for approval at their last meeting. And we want to we want to make sure that we are acknowledging our frontline nurse staff with this bonus, but then we'll be proposing to include the supervisors and that level within the overall bonus, so that everyone is getting compensated for the hard work they've done these past.
Thank you for not kicking me.
Any other comments or discussion?
I move we adopt these 2 proposals.
Okay, I have a motion by Steve to adopt them. I'm sorry, by Mark to, I'm crazy, by Mark to accept the proposal, and I got a second from my favorite signaler up there. Well, I have to run down the list here of people here. So I'll just go down and please acknowledge yes or no. Daryl Adams,
Yes.
Chip Buckwell,
Yes.
Kim Daylor,
Yes.
Dan Hagler,
Yes.
Steve Morris,
Yes.
Cecilia Plez,
Yes.
Asha Rodriguez,
Yes.
Mark Spitzer,
Yes.
and Laura Pons, yes. So the motion carries for the proposal. Next item on the agenda, I believe, is announcements.
If I could just make one small announcement here. As part of the email I sent out the other day notifying you all for this special meeting, I also mentioned that we have our first monkeypox case in the county. We will be doing an update and giving you more information about that at our August 16th meeting. But did just want to let everyone know that we have sent out a press release to notify, and we are now looking at that particular issue. We've recently ordered vaccine so that we can start. We are already testing at our health department, and we'll be hopefully shortly be able to be providing vaccine. But there is a sort of a shortage in getting that distributed, but we are next in line to get some of the vaccine. And again, I do want to say thank you for how quickly you were all willing to be flexible and join in for the call tonight.
Any other announcements? I don't think we have any. Our next meeting is August 16th at Tuesday. And hopefully we'll see you all there, and really appreciate you coming together tonight. Appreciate the hard work of our school nurses, and want to recognize them and their supervisors who are willing to step up and help our children, who are our most important resource. So thank you all so much. I have a motion to adjourn. Bonnie's keeping me honest. Motion to adjourn. Chip
motion to
Buckwell.
adjourn.
Okay, motion to, oh, Kim says she
Kim.
approves. Okay, I'm gonna do this one more time. I'm gonna, everybody unmute yourself right now. Daryl Adams,
Yes.
Chip Buckwell,
Yes.
Kim Taylor,
Yes.
Dan Hagler,
Yep.
Steve Morris,
Yes.
Cecilia Ples.
Yes.
Thank you for being at, where are you?
Night out.
Night out.
National Night Out.
Yeah, thank you for being there. Asha Rodriguez,
Yes.
Mark Spitzer,
Yes.
and Laura Potts.
So yes.
Yes. Sorry. Okay, thank you all very much.
Thank you,
and have a great
everyone.
night.